Megan asked me a while back if I would talk about why I liked ObamaCare. This discussion had come up a couple of times in our CBL group, and I made some comments at that point. And so I want to thank you for inviting me, and I appreciate the openness to share why I think the way I think. That's really what I want to concentrate on, not a debate. I don't really hope, I hope this won't turn into a debate. I'm not a debater. Debates have winners and losers, and just like we see in politics at the moment, there's this vilification going on. And I hope we can set that kind of thing aside, because I think all of us on any side of this position really want good. We want good to come of it. So, with a respect for each other, we might disagree. I mean, I don't see you as a villain. I hope you don't see me as a villain. I hope we are all in this together, seeking what's best. And that's a win-win. And I think we get that win-win when we consider one another's ideas, and then we find out that maybe somebody has a better idea than I have. And we can work together for that common good. Now, to really get into this, I have to share my philosophical foundation, because if you don't understand that, then you're not going to understand why I believe the way I do. And with this foundation, I think you'll have a better understanding of where I'm coming from. Now, Abraham Lincoln said, "My concern is not whether God is on our side, my greatest concern is to be on God's side." And I believe in the creation account, not necessarily literally, but I believe God is the reason we are here. It says in the book of Genesis in the Bible that God placed his image on humankind. So there's a respect that I have for human beings because we are the image bearers of God. So I think all men and women are, in essence, created equal with that image that they bear. So there's an equality, not necessarily in function and abilities, but there's an equality in the basic human rights that we all share. Now, we can debate on what rights those are, but if you look at some other quotes that we have, somebody came to Jesus once and asked him, "What are the greatest commandments?" At that point, there was a long list of commandments, and they were a little bit burdensome to people, the Jewish people at that time, when they asked Jesus, "Well, what are the important ones? What should we concentrate on?" And Jesus, who, if I could say, was a philosopher in his own right, said, "Love God and love your neighbor as yourself." And that as yourself, if you really think about how profound that is, if you treat everybody as you want to be treated. And that's where the golden rule, which, the golden rule, when I was in school many, many years ago, every classroom had the golden rule posted. Do unto others as you would have them do unto you. I don't think I've seen it anywhere, printed anywhere for a long time. But hopefully you're all aware of that. And, that comes out of Jesus' statement, I believe. A lot of people even think this is in the Bible. The golden rule itself is not in the Bible. But basically, if you treat everybody like you want to be treated, just think of the impact on society that would have. So, the man who asked Jesus those questions, when Jesus gave him that answer, said, "Well, then who's my neighbor?" Because he didn't like, it was a little uncomfortable, and who's the neighbor? And Jesus basically told him the story of the Good Samaritan at that point, but he also, later on in another passage, said basically the people who are down and out, people who are hungry, people who are unclothed, people who are thirsty, these are the people that deserve your attention. Those are, in essence, your neighbors, because what you do to them, you're in essence doing to God, because God's image is in them. So, that's kind of my basis of why I believe the way I do. There's an intrinsic worth of every human being, no matter what their socioeconomic status, no matter what their gender, no matter what their sexual preference. Everybody has intrinsic worth by the Creator. So, to me, that's the equalizer of all of us. And actually, then our job, I think, is to help be equalizers in a sense. That may sound kind of socialistic to some of you, but I think it's clear that Jesus asked us to pay attention to the people in special need because they need the extra help to make it in society. So that's kind of my theological, philosophical foundation, but let's look a little bit more at this. And you probably all have heard these talked about. There's the pillars of ethics, or especially medical ethics, where we talk about beneficence, do good, no maleficence, do no harm. We hear that lots and lots. Then there's this concept of justice, which is really supposed to be in the social context, social justice, doing the best for the most, or this concept of the common good. And then there's the autonomy aspect, which kind of balances that a little bit. When we think of autonomy, we think of the perceived best for the individual. Because what's perceived may not actually be the best for the individual. We can all think of examples of that. But the interesting thing is autonomy is the newcomer to the list. The top three were ancient, forever, Hippocrates. But autonomy is new. It's the most recent addition. It's from the Enlightenment era. And Immanuel Kant introduced that topic, or that concept of autonomy, but it was meant to be the freedom to do good. That's what autonomy in its original sense meant. Unfortunately, I think we've morphed that into the freedom to be selfish. I can do anything I want because this is what will benefit me, not necessarily the freedom to do good. So Thomas Hobbes, another Enlightenment thinker, said the right of all men to all things ought not to be retained, but that some certain rights ought to be transferred or relinquished. For if everyone should retain his right to all things, war would follow. He therefore acts against the reason of peace and against the law of nature. Okay, that's an Enlightenment thinker. So I think we need to shift the focus from autonomy, which is overbalanced in our American culture in particular, to justice. And we need to think about this concept of the common good. There's a book that I'm finishing reading. My wife read it. We heard Jim Wallace on NPR one day, and she ordered the book, and he was talking about this concept of what is the common good, where our politicians, whether they're on the right or the left, are struggling for these causes that really don't benefit the common good of our society. So, just to give you a little bit more of my background, I used to be pretty staunchly conservative. Now, you might think I sound liberal at times, but it's interesting. One of the medical students that was with me a while back, when he was an intern, one day said to me, he says, you know, when I first met you, I thought you were conservative because of some of the things we were talking about. And after today, I think you're liberal, but I don't know where you are. Well, it's great, because I want to be an independent, and I want to think individually on each topic and think through it through the filter of my philosophical and theological background. So, I would prefer to be an independent. On this topic, you're probably finding more progressive. But the things that shape this from my life are many, but I'd like to just share two incidents with you so you get a better understanding where I'm coming from here as well. I went to Honduras years ago. Our whole family went to be missionaries. We went to be evangelical missionaries, and pretty much everybody there was right-wing conservative. And as we were there, I began to see the U.S. through a different filter. We lived in the community with the Hondurans, and the community we lived in had been a fruit company town, Dole, where we get our pineapples and our bananas. It was a fruit company town. And when the business is good, people have jobs, minimum wage jobs, no benefits, so that we can get our 49-cent a pound bananas. But But when business is bad, they lose their jobs, no benefits. When they no longer can work, they're done, no retirement, they're just done. Cast away, like something that's no longer usable. And I began to see what we were doing to get our cheap bananas to the people who were trying to produce them. And I began to have a little bit different perspective on things because of that. The other thing that's been a big influence on me has been my youngest son, who's adopted, and he has some learning issues, and he has a mild form of autism, and he's extremely impulsive. He has bad judgment, and no matter what he does, no matter what we do as parents, he continues to make bad choices. Now, we have two other kids that we raised, and they're great, productive citizens out there. So, we used the same formula on our other son, and it didn't work. So, something's not right, and I think it's intrinsic to him. So, what I learned as I had patients in Nelsonville in particular, where lots of people that come see us at our hospital are Medicaid or uninsured, they have drug abuse problems, they've been in and out of jail, they've had multiple issues, and they just can't make the right decisions. I can sit with them and talk with them and think, okay, they got it. They go out and make the wrong decision, and they kind of click. They're just like my son. So that raises the question, who's responsible for them? Now, we are all successful. We have all been blessed. We can make the right choices. That's why we're here, right? And sometimes it's hard for us to understand people who can't make right choices. And I was there. I just wanted to kick them in the behind and say, come on, just it's your own fault. You're making these decisions, and you're suffering the consequences. Just make right choices. But there are people out there who cannot make right choices. So the question comes to mind is, what is our responsibility to them? Are they our neighbors? Do we owe them some care? So, with that, let's transition to healthcare. So what about healthcare? Well, Apollo 13 is one of my favorite movies because of the problem-solving thing. I lived through it in real life. I remember, being on edge, getting the TV every morning when you woke up, or getting the news on because you wanted to hear what was happening, or the astronauts going to make it. Well, Houston, we have a problem. Well, we have a problem in our country with healthcare because we each want it all, no matter what the cost. There's this unbalanced autonomy in the worst sense. And sometimes we don't even want it. It's the physicians that are part of the problem. My wife's here, and we went through a scenario with her father when he was at the end stages of his diabetes, where the doctors would not let him die. He had his living will. He did not want to go on a ventilator. He ended up on it twice, because once you get to the ER doc said he's not going to die on my shift. So we don't let people die. We put them on dialysis, we put pacemakers in them, we put defibrillators in them. Even when they're unconscious on a ventilator, we keep people alive at all costs, and literally all costs. The amount of money we spend on end-of-life care is one of the big generators toward bankruptcy for us. And part of it is because we want it for grandma, or we want it for our parent, or the medical system doesn't really even give us that option. It's they want it because they don't want this patient to die on their shift. And, unfortunately, we've been kind of brought up with this idea that death is the enemy. If a patient dies, we fail. We need to rethink that, because that's a big part of the problem. So, when we look at the economic aspect of this, the U.S. spends the most of any nation on healthcare, okay? This was in 2010, the numbers have just gone up, and we're still number one, over $8,000 per person per year. Number two, Norway, only comes in at a little over $5,000, big gap. And you can look at Canada and the UK. But when you look at the World Health Organization whoever makes the definitions wins the argument, so I don't have their definitions of efficiency, but it took into account a lot of statistics and the cost of care. But WHO, in 2010, ranked the U.S. 37th in efficiency, 15th in performance, okay, which would be outcome-based, the performance. Bloomberg, in 2013, ranked the U.S. down to 46th. Hong Kong's number 1, UK 14, Canada 7. You see, they're all spending a lot less than we are, and they're having better outcomes and more efficiency. What about all these nations ahead of us? They all provide universal coverage to their citizens. Maybe they have something to teach us. 32 of the world's 33 developed nations have universal health care. The U.S. is the only exception. Does that mean we're missing something, or are we the only one that has it right? I think we need to be honest with ourselves and ask that question. So, Paul Farmer, if you haven't read some of his writings, you should. And a lot of people have read the biography about him. You need to read what he has written. That's even better than the biography about him. But he said, and I'm paraphrasing here from his book, Mythologies of Power, because I couldn't find the exact paraphrase or the exact quote. But he basically said, if we want to export solutions to others around the world, we need to get it right at home first. And I think that's good wisdom. We need to figure this out here so that we can help others. So this is a multifactorial problem. There's no easy solution. Part of it is due to our affluence and this growing income disparity. Back in 1965, the CEO of a company made about 20 times of the janitor, the guy pushing the broom after hours. Okay? Now, or at least in 2012, 273 times what the guy pushing the broom. And the guy pushing the broom probably doesn't have benefits or health insurance. He's making minimum wage. But the CEO is making a whole lot more. So, that's America, right? That's capitalism. How about profit sharing? How about letting the guy pushing the broom, because he keeps the building looking nice for the clients, get a bigger part of what the company is generating? Recognizing the team approach to everything. You know, you might say I sound a little bit progressive, but indeed, I think we have a duty to help the people who help us accomplish our jobs. Another problem is the freedom to choose that we have. This autonomy, again, that's gone crazy. We can choose to make ourselves sick by eating inappropriately, by not exercising, by doing all the things that destroy our health. And then when we come 65, we turn to the government and say, okay, take care of me now. There's something wrong there. Who should bear the responsibility for the poor choices? Somehow we need to incentivize people to make healthy choices that will be cost effective and disincentivize those that aren't so healthy. And then there's that issue of illness versus crime. Are we putting people in prison for illness? People who can't make good decisions, are they being treated as criminals, or should they be given mental health care? So that's another big problem, and we could talk a lot about any of these. Then the other thing is the whole idea of the free market. You know, should we balance that with some regulations and protections? For every winner, there are losers. When you look at the stock market, there are people who are winning and there are people who are losing. And it tends to be the people who know how to play the game, know the rules best, are the winners. And those who have trouble with the rules, understanding them, are the ones who are losing. So we need to consider personal, social, as well as the corporate level consequences of all of this. I like the concept. Around Athens, you see this a lot. A lot of people are talking about fair market rather than free market. Should we be taking care of the guys picking the bananas in Honduras and giving them a better access to health care, some kind of retirement benefits, the things that we value in our country? That sounds more like a fair market. So then we come to this medical industrial complex, and I would suggest there is a real conflict of interest here. Is it based on profit or is it based on service? Well, right now, the medical industrial complex makes money when people are sick. We make money when we do procedures on people. We make money when we put devices in people. The drug companies make money when you buy their drugs. If everybody was well, you wouldn't have that profit. So there's this conflict of interest there. I'm on the phone frequently with insurance companies who are denying payment for a service that a patient needs. And I've got to argue. Usually they give in, but it's a struggle to get through to them because they make money by denying care to people. And then we have this whole idea of marketing, which I would question morality of this when we look at the bottom line. For example, there's a company that made the drug Prevacid. And when Prevacid came off patent and it went generic, to recapture their market, they came out with a new drug called Dexalent. They went and they tweaked the drug, added a little bit of changed the chemical structure slightly, and increased the half-life by 20 minutes. And we got flooded with their sales reps to tell us how much better their drug was because the half-life was 20 minutes longer. They had no studies showing that patients did better on the drug. It was all focused on this 20-minute half-life because they wanted to recapture the market. They didn't want to lose it. But the amount of money they put into that research, I would suggest could have better been spent. I mean, we've got a dozen drugs that can do the same thing. Why create another one? Why not create a new drug that would help people? Because this was cheap and easy to create. And then if you market it, you can make a lot of money. It's profit-driven. So I have a real concern with the way the medical industrial complex functions. So now, turning to finally to the title, what do I like about the Affordable Care Act? Lots of things. There's expanded coverage for preventive services. In my practice, for example, somebody who would qualify for a screening colonoscopy at age 50, if they didn't have insurance, they're going to pay $250 to $500 out of pocket. And for a lot of people, that's a lot of money. Enough to discourage them from having that colonoscopy. But now, 100% is covered. They don't have to pay a copay or a deductible on preventive services. They can come in, it's totally covered. So they're getting the procedure that we have decided with our science is helpful for them. So in that way, we're extending the coverage. There's expanded coverage for young adults. All three of my kids are still on my insurance policy. And other than my oldest son, the other two sure couldn't afford insurance on their own. So it's helping them. There's no pre-existing conditions. If you have Crohn's disease as a teenager and you go out to get your own insurance, in the past, they'd look at you and they'd say, oh no, we're not on our policy or not. Or you can pay this super high premium. Now, it's no longer an issue. You get insured if you have Crohn's disease. And then there's this concept of rescission, where if you spent too much, the insurance company could cancel your policy because you were too sick for them to make money on it. You can't do that anymore. Well, then there's this question of portability. I know that's an issue. You've been following the news about the health care plan was guaranteed you could keep your insurance policy if you had. Well, I had a little problem with that at the start, but once you get past this, ideally, if it works the way it's supposed to, if you like your policy here at the school, you should be able to take that with you forever in life. We'll see how it works out. But ideally, you should be able to keep your policy. And then the other thing that I really like about it is the wellness rules. You all know me, my interest in lifestyle medicine. Well, you can get a reduction in your policy premium up to 50% if you meet certain parameters. If you have an ideal BMI, if your cholesterol is low, you do these other things, you can save 50% on your policy by being well. So I like that kind of incentive. There's 30 million people who will be insured once this all kicks in, if it goes according to the plan. I know it's had a rocky start. And I think at least 10 million of them live in Nelsonville. It seems that way, because everybody's uninsured that comes to see me. So I'm looking forward to some of those patients having insurance. The hospital barely makes it because of our payer mix when we have so many people who are uninsured. There'll be increased funding for low-income health care. There's this expanded Medicaid coverage for people who are disabled, but they can stay home. They don't have to go to nursing homes. And the studies have shown clearly people do get better care at home, especially if you can subsidize that care. It's cheaper and it's better care if they can stay at home. There's expanded mental health care, which should help us from getting some of those people with mental illness taken care of rather than being criminalized. And there's extended rehabilitation services. And I know you guys haven't had the opportunity to be out there in practice, but I've seen enough patients who've been in car accidents and things like that, who their rehabilitation benefits run out, and they're not ready to get back to work. And they're stuck because they can't continue going to physical therapy because they don't have a job now, and they can't get better to get back into the workplace or into the job force. And then, you all want to like this, if you're going into primary care, a 10% Medicare bonus to primary care physicians. They also given it to general surgeons. I won't argue with that, but I don't know if they need it. Some lobbyists must have got their fingers into that. CMS, that's the Medicare and Medicaid services, are beginning to incentivize quality care. We're transitioning the system away from paying